Hello, my name is Robin Shuck. I'm a researcher at Children's Mercy Hospital in Kansas City, and I'm here to talk about an article that we recently had published in the September issue of Mayo Clinic Proceedings. It's got a really long title, but we think it is a really interesting study. The title is Adherence with Multiple National Healthy Lifestyle Recommendations in a Large Pediatric Center, Electronic Health Record, and Reduced Risk of Obesity. About 5 years ago, we embedded in the electronic health record at Children's Mercy Hospital 5 questions related to lifestyle. We had 1 question related to physical activity, 1 sedentary behavior, and then questions on water consumption, fruit and vegetable consumption, and dairy consumption. Over the past 5 years, we've been tracking this data, and we have now taken the answers provided by the parents, self-report, and created and compared them to national recommendations by a variety of different institutions in the United States. So, for example, the physical activity guidelines were used to identify the amount of physical activity that a child should be getting on a daily basis. For this analysis, we looked at meeting the criteria for those recommendations and the association with obesity. In Table 1, we have the demographic information from our participants. For this study, we had over 24,000 children's data in our electronic health record. Table 2 shows the prevalence with meeting the 5 different lifestyle factors in our sample, both overall and by sex. And for example, physical activity, 84% of our sample met the national recommendations for physical activity. 61% met the criteria for sedentary behavior. 27 met the criteria for dairy. 51% met the criteria for adequate water consumption, and only 10% met the criteria for fruit and vegetable consumption. Table 3 looks at the variation of meeting these criteria by both sex and age. And we found very interesting patterns that largely have been reported elsewhere in the literature, but serve as confirmation of the validity of our question in the electronic health record. Finally, in the figure that we included in the paper, we have the risk for obesity if a child does not meet a lifestyle factor. So, for example, not meeting the recommendations for physical activity were associated with a 1.65 increased risk of obesity. That was the highest among our 5 lifestyle factors. The second highest was sedentary behavior or screen time, which was not meeting the criteria for sedentary behavior was associated with a 1.36 increased risk for obesity. Dairy consumption and fruit and vegetable consumption were similar. Not meeting those criteria were associated with about a 1.2 risk for obesity. And paradoxically, meeting the criteria for water consumption was not meeting the criteria for water consumption was actually negatively associated and was preventive against obesity with an odds ratio of 0.74. So we think there are several really interesting findings here. The first is the simple one that we have demonstrated that you can use very simple questions to assess lifestyle and have those questions be associated with obesity. There was, however, considerable variation in meeting the national recommendations for each factor, and though the variation was associated with things like age, sex, and race and ethnicity. See physical activity for an example of that in Table 3. We also saw a large variation in each lifestyle factor and its association with obesity. So, for example, physical activity had the strongest, clearest relationship with obesity, whereas water consumption, as I mentioned, was a little bit paradoxical in our finding. There are several limitations to the study, the first and foremost being that it was cross-sectional, and so we cannot determine causation, only association. In conclusion, we found for the first time that 5 simple lifestyle questions embedded in the electronic health record are associated with obesity status. We feel that this supports having lifestyle questions added to electronic health records and be a part of normal annual physical or well child checks. We feel this is important in all healthcare systems, but particularly important in pediatric settings. Thanks for your time, and I hope you enjoy our article. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.